And now it's time for The Doctor Is In.
Hi, I'm April Douglas for The Doctor Is In, and today our guest is Dr. Nupur Shah, a cardiology fellow with USA Health, and we are talking about women's heart health. Thank you, Dr. Shah, for being here.
Thank you so much for having me.
Okay, let's get into it. What challenges do women face when it comes to their heart health?
The biggest challenge that women face when it comes to heart health is awareness. Not many women are aware, but heart disease is the leading cause of death in women, more than all cancers combined. More than 400,000 women, that is 1 in 3 women, die every year from heart disease. And 1 woman in every 90 seconds suffer from a heart attack, and that is quite concerning. Another challenge that we see is symptom recognition. Women often tend to present with chest pain that is associated with other non-cardiac symptoms, and that causes delay in seeking care, as well as the healthcare providers would look at that as non-cardiac condition and thereby delaying the diagnosis and treatment when it comes to heart attack.
1 in 3 is pretty shocking. What are some of the factors that put women at risk?
So the traditional risk factors like hypertension, diabetes, cholesterol, smoking, obesity, that remains crucial, and that still affects both men and women equally. However, women gets affected by women-specific and women-predominant risk factors that not many women are aware of. Like pregnancy-related complications, if you have had history of gestational hypertension, gestational diabetes, preeclampsia, preterm delivery, that puts a woman at increased risk for heart disease by 2 to 4 times. Also, autoimmune disease like rheumatoid arthritis and lupus is more common in women than in men, and so is anxiety and depression, and all these can increase the risk of heart disease in women when compared to men.
Quickly, if you could just tell us about what symptoms should we be paying attention to?
There's a misconception that women present with atypical presentation, but that's a misnomer and that should be abandoned. Women present with women-specific presentation, and 90% of the studies have confirmed that women do present with typical chest pain, but compared to men, they are more likely to report 3 or more additional non-cardiac symptoms like excessive sweating, fatigue, dizziness, nausea, vomiting, back pain, jaw pain. But when a woman comes with such a varied presentation, it must be taken seriously and a timely diagnosis and treatment must be received.
So make yourself aware and know that those are women-specific symptoms. We're going to get more into this on our Facebook. We'll hope you join us. Thank you, Dr. Shah. Join us on our Facebook page.